The least regulated state in the nation. It's a mantra that's been repeated by Governor Brad Little since 2019, since he took it upon himself to cut red tape and streamline our government regulations when it comes to administrative code. And Governor Little sang the same tune last week, least regulated state in the nation, when he announced another 466 pages of regulations being ripped from the code books. Now, granted, the reality of regulations is a bit boring. Deals with everything from the Barley Commission to the Tax Commission. But the message of that mantra has been picked up over the last few years by anyone who wants to point out the hypocrisy of least regulated state in the nation and all the restrictive laws passed by the state legislature. For example, the one we talked about yesterday regarding parental rights. In an effort to keep medical providers from performing medical procedures on kids without their parents' permission, Senate Bill 1329 is having a kind of cascading effect. The law covers a wide range of medical rights, including behavioral health and sexual assault, which we touched on yesterday. It also got Debbie in Boise to ask, are you aware what it did to the schools? The nurse can't help children with a Band-Aid, ice pack, not without parental consent. What the heck, she says. Idaho Code describes healthcare service as a service for diagnosis, screening, examination, prevention, treatment, cure, care, or relief of any physical or mental health condition, illness, injury, defect, or disease. So it's a bit broad. Yes, we know that, which is why different school districts are interpreting the law, well, differently. Debbie was right for the Boise School District. They sent out a letter to parents about their updated parental consent policy, saying the new law now requires parental consent before non-life-threatening medical services, meaning even Band-Aids, routine first aid, over-the-counter headache medications, and mental health check-ins. Those cannot be provided to a student without an okay from a parent. Now schools have to make sure a consent form is signed ahead of time before they can do anything. So Hunter Funk checked with the schools. Their consent form medications, I should say, and treatments of injuries are common. But Band-Aids and basic first aid, this is kind of where you just go, wait. How far are we going with this?
Exactly. You nailed it. Nurses can't do their jobs. Counselors can't be there for mental health services. That is until the parents sign that consent form, right? And they have to agree to allow it. Well, while Boise School District says they aren't a healthcare provider and don't diagnose medical conditions, they do provide services that are restricted by the new law. According to the statute, it states that anytime an individual provides a healthcare service like examinations and care, parental consent must first be received. Now, it's broad, but can prevent schools from doing anything like giving the treatment of a Band-Aid to an injury. Now, a one-time waiver to start the school year will work, and waivers for parents to sign like this are not new, but because of the new law, it has schools taking additional steps to make sure they're not breaking the law. It applies to all students 18 and under. Boise School District sent an email to parents about the adjustments because of the new law. Boise School District also sent us a statement about what they're telling staff. They say, quote, if a child requires non-life-threatening medical care or mental health treatment and no parent is available to provide consent promptly, please just use your best judgment and provide the care that is needed. West Ada School District taking precautions as well. The district said West Ada has been using the same consent to treat protocol for over 15 years. While we maintain our established practices, we're now operating with an increased level of awareness in light of recent legislation. Now, remember that parental consent is not necessary if it is an emergency, specifically if it's to prevent death or irreparable physical injury to a minor, or Brian, after a reasonable, diligent effort where a nurse can't contact the parent and the minor might have life or health is seriously endangered in that delay of care.
Right, if they can't get a hold of a parent, then they just kind of let that go. I was just looking at like West Ada. They have always required the acetaminophen or the ibuprofen. You have to consent to that ahead of time, but it doesn't say anything on that form about Band-Aids or anything like that.
Right. So. My mom is a secretary for a school. I talked to her about this. I said, hey, do you know? And she goes, wait, a Band-Aid? I didn't realize that we need to do this. Now the school district is looking into that as well.
Yeah.
So.
And Boise saying, look, let's just be reasonable with this, which makes sense. All right. Thank you very much, Hunter.